Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. Today I'm joined by Melissa Lumen, and the topic today is the Child Life program. So my first question for you today is, what is Child Life?
Child Life really focuses on helping children and families with the stress of hospitalization, illness, injury, all of those things that go along with why they're here. Child Life specialists really utilize play and focus on developmentally appropriate interventions to help children process procedures, learn about their diagnosis, and also we're really just here to help reduce fear, anxiety, and help children cope with pain in the hospital.
In what ways does the Child Life team create a positive experience for pediatric patients?
We really focus on both the medical piece and the emotional psychological piece of hospitalization and illness. On the medical side, we're helping them understand why they're here, what procedures are going to happen. We're spending time to make sure that they're really mastering their own diagnosis. They're going to understand what to do while here in the hospital and what's going on at home. But we also recognize that being here at the hospital takes them away from family, friends, all of those normal experiences they would be having otherwise. So we do special events, we do things around the holidays, we have a Halloween parade every year so that they can go trick-or-treating here at the hospital. It really brings normalizing from what they would be doing at home into the hospital to really help speed the recovery process along.
What sort of tactics do you use to help educate children about upcoming procedures?
It really depends on the developmental age of the child. We also take into consideration their learning style. So some kids do really great with books. We always try to use medical equipment when possible because it's going to expose them to the equipment ahead of time, making it easier when they see it day of procedure. Some children do really well with dolls. We actually have teaching dolls that show different pieces of the body. They can open up to see what's under our skin so they can understand where maybe a port goes in their chest, what that would look like inside and on the outside to help them understand. And some kids really need like step-by-step what's going to happen through the process, so we can even create little books that have every little detail of what's going to happen so that they can walk through their process ahead of time. So we really individualize it to the child. So this is one of our teaching dolls that we have. This really benefits children to be able to see what their IV or port is going to look like in their body to help them understand how it works. So we have all different kinds of attachments that we can put on our doll. This is an example that shows the heart and how the lines come out from. We can remove it and they can actually feel what the port is going to feel like inside of their body. So there's all these great attachments we can put on to specialize it for each individual child's needs.
How does play help a child express their feelings about their illness or hospital experience?
Play is a universal language and a normal piece of development, so we really use play in everything we do, whether it's teaching them about what's going to happen in their procedure or diagnosis. We can also use it for them to act out their emotions behind being in the hospital. Sometimes it's even separation from parents or friends. During their play, we can see if there's any misconceptions about why they're at the hospital and help correct those to help them better understand. And really just giving them normal play experiences as well here at the hospital. So play is really at the center of everything we do as child life specialists.
How does understanding their diagnosis and treatment plan benefit a patient's mental well-being?
Really, children process information so differently than adults. They're really still defining who they are and building their coping skill set for later in life. We really hope that what we're giving them is the ability to process all of these interactions, and they're going to carry that into the future with them. Understanding what's going to happen really makes it less scary and less intimidating during the moment. And then they're really conquering their own fears and mastering their own experiences. They carry that through the rest of their life, and without that, they're at a greater risk of negative impact on their life in the future.
How does Child Life help siblings or parents cope with their brother, sister, or child's illness?
Illness impacts the entire family. If you think about parents or guardians, all of a sudden they're dealing with their child hearing the diagnosis for themselves, but also now they're thinking about money and job and childcare. So we can just be there as a shoulder, a sounding board. We can help reiterate information that the parents might have heard from the doctor, but their brains are in a million places. Sometimes we even just help them make lists of questions, so when the doctor comes in, it doesn't all fly out there before they start asking. So we really just try to be a resource for them too. For siblings, we take into consideration that they might be coming to the hospital and they might be seeing their sibling in a pretty scary experience. Since they saw them last, they might have an IV or they might be intubated. So we can use the same kind of preparation we use for our patients with siblings. So we might start in a room like this one and show them a doll with tubes, explain what each one does. It's a lot easier to understand that all of these scary things are actually helping their sibling before they walk into the room and see it for the first time. So we use that same kind of preparation. And we also work a lot with making sure the siblings feel included. It can be really intimidating, or it can be really sad for a sibling to all of a sudden feel like their parents aren't home as much, maybe they're not getting as much attention. So we make sure that there is still connection. If they can't come to the hospital, we can work on pictures or cards, things that go back and forth to make sure they're still feeling included in the relationship.
What are some different examples of programs you use for Child Life?
For our programs, we have a lot of different groups that help us as well. We're incredibly excited that we have a music therapist on our staff now. She just does phenomenal work with our patients. I think the biggest impact she has is really on the emotional side. She helps them write lyrics to talk about how they're feeling about their diagnosis or the emotions that they're having. And she uses the music, even on the younger kids, they can act out their feelings, they can bang on drums, or she can do distraction just like we do. We might utilize I Spy and coping, and she uses music. So she is an amazing addition to our team. We also utilize volunteers here in the waiting rooms and playrooms. We help train them. We have Hole in the Wall gang that comes, so their outreach, they come do fun things. They do amazing activities with duct tape. I'm always amazed by the things that they can do. So it's just another group that comes and does activities. We also have a relationship with the Ronald McDonald Foundation. They gave us a Happy Wheels cart. So it's a comfort cart. The top has food and snacks for parents and families. As a parent, you can imagine you might not want to leave the room to go down to the cafeteria. And there's also some fun activities in the side of the cart, so our volunteers help bring that around. And we're really lucky that we have a lot of support from the community. We have some really amazing donors, families that for years have been running events or giving back to us to help make activities in the playroom or renovations, or even just the items that we have available to pass the time or provide comfort available for our kids.
How important is it to comfort families when they arrive?
It's so stressful walking into the hospital. Even if you were coming in as a patient yourself, there's just so much stress there. Providing any kind of comfort to the patients and families really helps reduce the anxiety they're feeling. That helps bring down a stress level. A calmer parent has a calmer child, and a calmer child has a calmer parent. So we really try to look at the whole package and what we can do to make sure, I mean, sometimes it's forgetting things they need at home. Can we go find that for them? Anything we can do to really enhance the patient experience and improve the family experience while they're here.